everybody, and thank you again for joining us. Our topic of discussion today is PTSD, which is post-traumatic stress disorder. There's the assumption that PTSD only exists for individuals who have been involved in military service. And we want to dispel that myth and we want to discuss how PTSD affects the general population as well. So let's start with our overview of information. Um, First off, the discussion will include what is PTSD. I'll give you a little bit of information on the statistics as it refers to PTSD in the general population. We'll talk about the risk factors, who's at the highest risk. We'll talk about the diagnostic criteria for PTSD, what some of the symptoms are, the complications that are associated with PTSD, when it's time to call a doctor or consult a physician. We'll talk about treatment and prevention of PTSD and some resources that are available to you to assist with dealing with PTSD, whether it is you or if it is a family member. So let's get started. What is PTSD? A lot of people just don't know how to put their fingers on a description of what PTSD is. So let's start by saying that it's a psychological disorder, and it's a disorder in which a person has difficulty recovering after experiencing or even witnessing terrifying or traumatic events. That might be something like abuse, whether that be physical, sexual, or emotional, natural disasters such as tornadoes, floods, hurricanes, a number of disasters, serious accidents to include traffic accidents, terrorist attacks, war, combat exposure, intimate partner relationship violence, and medical illness. Any of these can cause PTSD. However, most individuals who experience these kinds of traumas don't go on to actually develop PTSD itself. Um, Many individuals develop symptoms within 3 months of experiencing a trauma, but some of these symptoms can appear as late as months or years, and they may persist for months or sometimes even years. PTSD often occurs with other related conditions as well, such as depression, substance abuse, memory loss or memory problems, and other physical and mental conditions. So, in the United States today, PTSD can occur in anyone of any ethnicity, nationality, culture, and age. The prevalence for PTSD in the United States is estimated to be about 4% of the U.S. adult population, 8% of the adolescent population between the ages of 13 and 18, and can be diagnosed in children at any age. The lifetime prevalence in the United States is estimated to be approximately 6% of our overall population. So this is an ongoing issue that is not necessarily recognized throughout the country. So what are the risk factors? They include a prior history of trauma and the severity and frequency of the events, perceived lack of support following these events. It can be childhood adversity or trauma. Being female or a female gender can also be a risk factor due to abuse and violence that have been applied to females. Males as well, but females are more prevalent. Members of a marginal group, such as non-white, LGBTQ, or living with a disability. These can also be risk factors for PTSD. And your migration status, your immigration status, can also be a risk factor. So when we look at the temperamental risk factors, some of the risk factors for PTSD can be apparent in childhood. Identifying the risk factors for PTSD can include as many things, to include emotional challenges or vulnerability as a young child or during childhood, previous mental health problems, including depression or obsessive compulsive disorders, and a tendency to feel more depressed or anxious when compared to other individuals of the same age groups. So there are environmental risk factors for PTSD as well. Research has shown that people who've experienced more severe or extreme traumas, like mass shootings, combat exposure, they're more likely to develop PTSD than individuals who have not experienced those types of traumatic stress. Challenges or overwhelming experiences in childhood can lead some people to be more vulnerable to PTSD as compared to others as they grow older. Environmental factors that can increase the risk of PTSD can be low socioeconomic status, lower education levels, being exposed to trauma as a small child or during childhood, to include physical, emotional, or sexual abuse, family dysfunction, experiencing discrimination or racism, or losing a parent or a guardian during situations such as separation or death. So when we look at the genetic factors that put people at risk for PTSD, having a family history of mental health problems can increase one's risk for PTSD as well. This is similar to having an increase for depression, bipolar disorder, and other conditions that may affect close family members, to include severe illness as well. So the diagnostic criteria for PTSD that can include negative alterations in mood, alterations in arousal and reactivity, the duration of depression, avoidance, intrusions, stressors that can occur in everyday life, exclusions, or the use of medications or the lack of medication availability, and functional significance, feeling as though you're an outsider, that you have a conspiracy theory, um, being alienated. All of those can be part of the diagnostic criteria for identifying and evaluating PTSD. One of the questions that was asked was, can PTSD mimic attention deficit hyperactivity disorder in children? The answer to that question is yes. PTSD disorder can mimic ADHD in kids, particularly in the way that these symptoms appear. When we look at it, both conditions can cause difficulties with concentration, impulsivity, hyperactivity, leading to a potential misdiagnosis of PTSD as being attention deficit disorder. Children of all ages can be diagnosed with PTSD. While the core symptoms in PTSD may be consistent across age groups, the way that they manifest in children especially infants and young children, can be very different. Some of those similarities are inattentiveness or inattention. Both ADHD and PTSD can cause difficulty focusing, staying on task. Kids with PTSD might experience disassociation or be avoiding trauma reminders and triggers, which can look like inattention. Hyperactivity or restlessness. Children with PTSD may exhibit restlessness or agitation due to being on high alert, a symptom that can overlap with hyperactivity and ADHD. Impulsivity. Impulsive uh, thoughts and memories related to trauma can lead to impulsive behaviors in kids and PTSD, making them appear similar to children with ADHD. And emotional regulation. Both conditions can affect emotional regulation, leading to irritability, anxiety, difficult managing strong emotion, having anger outbursts, shutting down, ignoring individuals, especially individuals of authority. So, who's at the highest risk for PTSD? It's been studied, and PTSD in particularly has been prevalent among individuals with occupational groups such as police officers, firefighters, medical workers, and military personnel, all of whom can experience events that might trigger PTSD. The anxiety and flashbacks triggered in a traumatic event are what can lead to PTSD. And so these individuals in these occupational groups experience these traumatic events on a daily basis. And how they respond to them is what develops those triggers. So, can exercise or diet affect these triggers? Absolutely. Yes, regular exercise and a balanced diet can significantly impact PTSD triggers. They do so by improving the overall mental health and physical health of the individual and their ability to cope with stress. While diet and exercise are not necessarily a cure, these lifestyle factors can reduce the intensity of these triggers and help to improve the individual's ability to manage them. Exercise, particularly aerobic and mind and body activities, can help to reduce anxiety and improve mood. And by reducing the anxiety and improving the mood, the triggers become less intense. A balanced diet, rich in whole grains, fruits, vegetables, lean meats, and healthy fats, can also support overall mental health and well being. What that really means is the avoidance of fast foods, fatty foods, and fried foods. So, who again is at risk for PTSD? A systematic review was done that showed the prevalence of PTSD in military personnel and other high risk occupation groups is almost twice as high as that of the general public. Other more recent views identify a number of occupational groups that we just discussed: healthcare workers, police officers, prison workers, emergency personnel. These individuals are all at increased risk due to the traumatic events they experience. Also, various specific work-related exposures to situations or conditions at work that may affect an individual can be associated with PTSD. Those include military personnel, first responders, and later review also identified individuals like journalists, healthcare workers, and individuals who are exposed to other traumatic events and the aftermath thereof. We saw a number of individuals who experienced PTSD post 9/11. Despite this evidence, the association of work-related exposure to PTSD hasn't been qualified in a meta-analysis. So the actual numbers and actual triggers haven't been completely validated. Such knowledge is important, though, to answer the questions regarding work-related causations and prevention, and is a prelude to develop these interventions to address PTSD. So again, symptoms. The symptoms of PTSD fall into several different categories. Specific symptoms can vary in their severity. Intrusion or intrusive, unwanted and involuntary thoughts such as repeated memories of the situation, distressing dreams, flashbacks of traumatic events. Flashbacks may also be vivid and so vivid that people feel like they are reliving the experience. They can cause panic. These memories and or nightmares can trigger something that reminds the individuals of a traumatic event or even may be spontaneous. Avoidance. Avoiding the reminders of the traumatic event may include avoiding people, places, activities, objects, situations, and they may trigger distressing memories. People may try to avoid remembering or thinking about the traumatic event. Additionally, this may cause them to resist talking about what happened or how they feel about the situation. And oftentimes, these behaviors can lead to dysfunction in their everyday life. They tend to shut down, close down, avoid communication and conversation. Some important considerations are personal guidance. It's critical to consult with a healthcare provider or a therapist for an individual that is having these personalized, advanced situations and circumstances. Managing the symptoms and developing appropriate exercise and diet plans are very important. Therapy. Again, exercise and diet are complementary to therapy and other treatments for PTSD. Therapies such as cognitive behavioral therapy, exposure therapy can be highly effective in addressing the root cause of PTSD in some individuals. Support systems. Building a strong support system of friends, family, and professionals can help to manage these symptoms. And it's important to understand that gradual changes are important. Making gradual changes to diet and exercise routine can make it easier to maintain healthy habits and avoid overwhelming yourself with these immediate and what feels like permanent changes. So the symptoms of PTSD, again, changes in cognition and mood. Individuals may initially present with depressive symptoms. These include low mood, feeling sad, the inability to feel happiness, and a lack of interest in activities or people that they used to enjoy. Additionally, individuals with PTSD could have memory problems, may be unable to remember important aspects of the traumatic event, and have negative thoughts and feelings leading to ongoing and distorted behaviors about themselves or about others. They may feel like they're a bad person. No one can be trusted. There's a feeling of paranoia. They can have disordered thoughts about the cause of or consequences of the events, leading to that wrong, blaming self or blaming others. They may have ongoing fears, horror, anger, guilt, or shame. They may have less interest in activities previously enjoyed, feeling detached or estranged from others, or being unable to experience positive emotions, a void of happiness or satisfaction. All of these symptoms are related to the effects of PTSD. Some additional symptoms: changes in arousal and reactivity. People with PTSD may be described as irritable, having anger outbursts, restless or reckless behavior, or a self destructive temperament, being overwhelmed, watchful of their surroundings, being suspicious, being easily startled, or having problems concentrating or sleeping. Changes in physical and emotional reaction. These are very common symptoms that are seen. Changes in physical and emotional reactions, also called arousal symptoms, may include easily startled or frightened, always being on guard for danger, self-destructive behavior such as drinking too much, driving too fast, reverting to excessive use of medications or non-prescribed medications, difficulty sleeping, trouble concentrating, irritability, angry outbursts, aggressive behavior towards self or others, physical reactions such as sweating, rapid breathing, fast heartbeat, shaking. For kids 6 years of age and younger, symptoms can also include reenactment of traumatic events or aspects of traumatic events through play, frightening dreams. They may or may not include aspect of the traumatic events. It's just they awake. Some people call them night terrors. These can also be symptoms of PTSD in children. Some of the complications that are associated with PTSD can be disruption of your daily life, your job, your education, how well you get along with others, physical health, and enjoyment of everyday activities. Having PTSD may raise your risk of other health conditions to include mental problems, depression and anxiety, issues with drugs or alcohol use, and thinking or attempting suicide. Substance abuse and PTSD. Problems with substance abuse, drugs, or alcohol often go hand in hand with PTSD. The use of alcohol and or drugs can put people in risky situations that lead to additional traumatic events. At the same time, people may use drugs or alcohol to try to manage the disease or the symptoms of PTSD. In the United States today, about out of every 10 adults who actually have PTSD have problems with drugs or alcohol. Research suggests that most people who have both PTSD and drug and alcohol abuse, the PTSD develops first. Using drugs and alcohol can make PTSD worsen. For example, although some people use alcohol to help them sleep, in reality, alcohol can make sleeplessness more prevalent. Using drugs can increase irritability, feelings of avoidance, and some paranoia. Getting treatment for PTSD or using positive coping actions can better provide positive outcomes and help to turn the individual away from drug and alcohol use. So, when is it time to seek medical or professional help? You should talk to your healthcare professional or your mental health professional if you're having disturbing thoughts and feelings about a traumatic event for more than a month, especially if these are severe. Also, seeing a healthcare professional is important if you're having trouble getting your life back on control after these traumatic events. Getting treatment as soon as possible can help prevent the symptoms of PTSD from getting worse. So, if you're having suicidal thoughts, or if you know someone who has the suicidal thoughts, get help right away. Reach out to a close friend or a loved one. Contact a minister, a spiritual leader, or someone in your faith community. Contact a suicide prevention hotline. In the United States today, you can call or text 988 to reach the 988 suicide crisis line, which is available 24 hours a day, 7 days a week. Or use the Lifeline chat. This is a service that is free and confidential. U.S. vets or service members who are in crisis can call 988 and then press 1 for the Veterans Crisis Line, or text 838-255 or chat online. The Suicide and Life, the Crisis Lifeline in the United States has both English and Spanish. The Spanish phone line is 1-888-628-9454. That is a toll-free number. And you can make an appointment with your healthcare provider or mental health professional to assist with identifying the symptoms and helping to provide treatment and support. So when we talk about treatment for people with PTSD can include psychotherapy or talk therapy and or medications. Most research starts with slow psychotherapy, and it has been found that it is more effective than putting the individual on medications right away, and should be considered the first line treatment in most cases. However, for some people, it's different and PTSD impacts them differently. So a treatment that works for one individual may not be effective for another. So these treatment plans are individualized. It's important, though, for anyone with PTSD to be treated by a mental health provider who is experienced in dealing with PTSD. Some people with PTSD need to try different types of treatment to find what works best for them. In someone with PTSD going through an ongoing trauma, such as dealing with an abusive relationships or current substance abuse, both the problems need to be addressed, not one or the other. Other ongoing problems that include panic disorder, depression, thoughts of suicide should be seen immediately by a professional and seek a qualified mental health provider. Prevention. After surviving a traumatic event, many people with PTSD-like symptoms at first, such as not being able to stop thinking about what's happened, fear, anxiety, depression, guilt, are some common reactions to trauma, but they don't necessarily go on to develop PTSD. Getting timely help and support may prevent unusual stress reactions from getting worse and leading to PTSD. This may mean turning to a family member or a friend who will listen and offer comfort. It may also mean seeking mental health professional support for a brief course of time. Some people may find it helpful to turn to their faith community as well. Support from others may also prevent you from turning to unhealthy coping mechanisms such as misuse of drugs and alcohol. So we've provided some resources that will be available for you when this presentation becomes available. So we just kind of wanted to go over those rather briefly. So for the military, especially the Air Force personnel, military treatment is available through CONUS or OCONUS. You should locate your MTF, your military treatment facility, and reach out to them for additional support. Post-traumatic stress disorder information is available on Midline Plus. Traumatic events and post-traumatic stress disorder information is available through the National Institute of Mental Health, and information is available through the National Center of PTSD through the U.S. Department of Veteran Affairs. Local resources here in San Antonio for vets are available. And there are resources available for both family members and the individuals with PTSD. And we have some of those listed here. I'm not going to go through all of them, but they are available to you and will be available when you receive the slides. Other resources for non-vets are available as well, to include those resources that are listed on your medical plan. And we've listed some of these for you here as well. So with that information, I'll now ask if you have questions that we have not addressed. I thank you for your time, and now is the opportunity for us to address any of those questions.
If you have any questions, you can place them in the chat, or you can take yourself off of mute and ask the question.
I know we covered a lot of information, and again, if you have additional questions, I am available. Those resources are also available to you. And as Heather can confirm, the resources that we do have listed are all covered under your health plan based on your benefits. Does anyone have any additional questions that I can address?
It doesn't look like it.
Well, if there are no further questions, again, thank you for your time. Um, just know that we do have other presentations that are going to be available to you. As Heather mentioned, we have a presentation in the month of July on eye disease, and I look forward to speaking with you guys again. I hope you have a great day and a great rest of your week.
Thank you for joining us.